Welcome to a deep dive into a fascinating study on veterinary neurology. Today, we're exploring the effects of a specific treatment on dogs recovering from spinal cord injuries. The study, titled Effect of Local Epidural Application of Methylprednisolone Acetate on Time to Ambulation in Non-Ambulatory Dogs with Thoracolumbar Intervertebral Disc Disease, a prospective randomized, blinded control trial, published in Veterinary Record in 2024, investigates how locally applied steroid can influence recovery time after surgery for a common canine ailment. Intervertebral disc disease, or IVDD, is a prevalent condition affecting the canine spine, particularly in the thoracolumbar region. This disease often stems from the extrusion or protrusion of disc material, leading to spinal cord compression. The primary treatment for non-ambulatory dogs with IVDD is surgical decompression, but nursing care can be complex and costly. Consequently, researchers have explored various strategies to speed up the time it takes for dogs to regain their ability to walk or ambulate. These include treatments like metalloproteinase inhibitors, dimethylsulfoxide, postoperative physiotherapy, and photobiomodulation, each with varying degrees of success. For instance, a study found that a metalloproteinase inhibitor improved motor scores by 150% compared to a control group. Another study showed that intensive rehabilitation, including underwater treadmill sessions, increased the likelihood of dogs regaining ambulatory ability. However, the effectiveness of photobiomodulation therapy to shorten the time to ambulation was not statistically significant in another study. When a disc herniates, it not only causes mechanical compression but also initiates an inflammatory cascade, resulting in secondary injury to the spinal cord and nerves. This inflammation, often characterized by neutrophil invasion and the formation of granulation tissue, has been shown to inversely correlate with the ability to regain ambulation. Moreover, spinal cord injury provokes an inflammatory response within the spinal cord itself, which can cause further damage due to the release of destructive enzymes. Given the role of inflammation in hindering recovery, this study explored using anti-inflammatory and neuroprotective strategies to improve outcomes in dogs suffering from IVDD. While systemic corticosteroids like methylprednisolone sodium succinate, MPSS, have been used in the past, studies have shown they don't significantly improve recovery in canine spinal cord injury and can lead to side effects. However, epidural steroid injections have proven successful in treating lower back pain due to lumbar disc herniation in humans. Moreover, previous research in dogs has shown that epidural infiltration of methylprednisolone acetate can be safe and effective in treating lumbosacral degenerative stenosis. This led researchers to investigate the potential benefits of locally applied methylprednisolone acetate on the recovery of dogs undergoing surgery for IVDD. Their hypothesis was that this local application could have an anti-inflammatory effect within the epidural space and enhance recovery of spinal axons, thereby accelerating ambulation. Now let's explore the methodology of this study. 41 dogs diagnosed with acute thoracolumbar IVDD via MRI, all presenting with non-ambulatory paraparesis with intact nociception, were enrolled in this prospective, randomized, and blinded controlled trial. The study was approved by the Swiss National, Cantonal and Institutional Animal Care and Use Committees, and informed consent was obtained from all pet owners. The sensorimotor status of the dogs was assessed using the modified Frankel score, MFS. Dogs with an MFS of 2 or 3, classified as non-ambulatory, were included in the study, while those receiving pre-surgical steroids or with multiple affected sites were excluded. The included dogs were randomly assigned to either a control group or a treatment group. All dogs underwent standard decompressive surgery via mini-hemilaminectomy, where herniated disc material was removed. In the control group, saline was locally applied after surgery. In the treatment group, methylprednisolone acetate at a dose of 1 mg per kilogram was applied locally. Both substances were administered using the same method and volume. The surgeons and the clinical staff assessing the time to ambulation were blinded to the group allocations, ensuring an unbiased evaluation. The dogs were premedicated using combinations of butorphanol or methadone with acepromazine or medetomidine. Anesthesia was induced with propofol and maintained with isoflurane, with constant monitoring of vital signs. During surgery, dogs were placed in sternal oblique recumbency. The surgical technique involved a dorsolateral approach, with mini-hemilaminectomy performed using a high-speed burr. The spinal nerve roots were freed, and extruded disc material was removed using rongeurs. Postoperative care included daily neurological evaluations, manual bladder expression as needed, analgesia with NSAIDs and opiates, and a hospital stay until independent ambulation was observed. Independent ambulation was defined as the ability to take 10 consecutive, unassisted weight-bearing steps. The time to ambulation was the primary outcome measure. Other parameters, such as breed, body weight, age, sex, and the time between the onset of clinical signs and treatment, were also recorded. Postoperative complications were monitored for 6 months after surgery via follow-up visits or phone communication. To analyze the data, the researchers used a multiple regression model and quantile regression, because the data was not normally distributed. Quantile regression allowed for evaluation of the effects of methylprednisolone acetate, body weight, and age on ambulation time. The statistical analysis was performed using a p-value of less than 0.05 to indicate statistical significance. Let's delve into the results of this study. The study included 41 dogs with a median body weight of 9 kilograms. The most common breeds were French bulldogs, mixed breeds, Balancas, and dachshunds. The median age of the dogs was 63 months, with a range from 27.6 to 156 months. The control group consisted of 23 dogs and the treatment group had 18 dogs. The most frequent locations of intervertebral disc extrusion were TH13L1, L1-2, TH12-13, and L3-4. The median time from the onset of clinical signs to treatment was 1 day for the control group and 2 days for the treatment group. The results showed a significant difference in time to ambulation between the two groups. The control group achieved ambulation in a median of 7 days, with a range of 1 to 17 days. In contrast, the treatment group achieved ambulation in a median of 3 days, with a range of 1 to 8 days. This data is represented graphically in Figure 1, which shows a clear difference between the two groups, with the treatment group demonstrating a quicker recovery compared to the control group with the box plot. The box plot represents the median time to ambulation of the control group, blue, at 7 days, while the treatment group, orange, had a median of 3 days. Quantile regression analysis revealed that dogs in the treatment group achieved ambulation a median of 4 days faster than those in the control group. The analysis also showed that dogs with shorter recovery times, less than 2 days, and longer recovery times, more than 8 days, in the treatment group exhibited significantly shorter recovery times than the control group. Furthermore, age was found to significantly influence recovery time in dogs with shorter recovery times, while body weight had no significant effect on the recovery time. Table 1 summarizes the quantile regression analysis parameters, including beta values, 95% confidence intervals, and p-values. This table demonstrates the treatment option has a statistically significant negative correlation with ambulation time, suggesting faster recovery times. One notable adverse event was observed. A 10-year-old Burger de Pyrenees in the treatment group developed discus spondylitis and an abscess at the surgical site 3 weeks after surgery. This case represented 2.4% of the total study population and 6% of the treatment group. The dog was treated with further surgery, vertebral stabilization, and antibiotics, and eventually regained ambulation. No other adverse events were reported in the study. Now let's discuss the implications of these findings. The primary conclusion of the study is that local application of methylprednisolone acetate at the time of surgery may accelerate recovery in non-ambulatory dogs with thoracolumbar intervertebral disc disease. The shorter ambulation times observed in the treatment group suggest that the anti-inflammatory properties of methylprednisolone acetate may enhance spinal cord conduction after decompression. The varied reductions in recovery time, with more significant improvements in the longer recovery time quartile, indicate that the treatment might be particularly beneficial for dogs that typically require a longer time to regain ambulation. The study also highlights age as a factor in recovery for dogs with shorter recovery times, indicating younger dogs may have faster recuperation. The case of discus spondylitis underscores potential risks associated with steroid use. Because steroids are immunosuppressive, they can increase the risk of surgical site infections. The study's overall complication rate of 2.4% is in line with other findings, but this particular case highlights the necessity of vigilance in managing postoperative complications. The researchers also pointed out that the use of 4 catheters for more than 24 hours after surgery may also have increased the risk of surgical site infection. They also noted that the findings raised the question of whether prophylactic antibiotics should be administered in cases with epidural application of steroids. The study notes the historical controversy surrounding systemic corticosteroids for treating IVDD due to inconsistent clinical efficacy and safety profiles. It contrasts the results from studies showing no significant improvement with systemic MPSS with the positive results obtained through local epidural application. Systemic corticosteroids, despite being used in human medicine for acute SCI, have not demonstrated significant improvement in motor or neurological scores. Moreover, in the veterinary literature, systemic MPSS has not shown significant benefits over other treatments, such as NSAIDs or placebo. The study also mentions that a systematic review showed marginal improvement of systemic steroids regarding pain sensation in lower back pain patients. However, it did not show the same marginal effect in patients with vertebral stenosis. Additionally, the potential benefits of steroids, such as reducing edema and inflammation, are counterbalanced by adverse effects like increased infection risk and gastrointestinal issues. The discussion emphasizes that IVD leads to mechanical compression and secondary injury of spinal cord tissue, triggering an inflammatory response. This inflammatory response, which includes the production of inflammatory molecules such as tumor necrosis factor, interleukin-1 beta, and IL-6, has also been documented in experimental rat models as well as naturally occurring cases in dogs. The use of MPSS has been shown to inhibit the production of these molecules. Furthermore, the study points out that there is an inverse correlation between the degree of inflammation and the ability of dogs to regain ambulation. This suggests that controlling the inflammatory response may have a role in improving recovery and, as such, local application of steroids may be an effective method to address the inflammatory response. The use of epidural steroids has also been shown to be effective for managing lower back pain due to lumbar disc herniation in humans. However, the information regarding its effect on intramedullary damage may not be entirely adequate. The researchers acknowledged some study limitations. The inclusion of dogs from a heterogeneous population, with varying breeds, ages, and health conditions, could impact the generalizability of the findings. However, quantile regression was used to address this issue, because it is robust against population heterogeneity, data skewness, and outliers. Another limitation was the lack of data on onset speed of clinical signs, which is difficult to collect from pet owners and referring veterinarians. Also, the study did not measure serum biomarkers for spinal cord trauma, such as glial fibrillary acidic protein and phosphorylated neurofilament heavy chain, which could indicate lesion severity. They note that including these biomarkers in future studies is important, but is dependent on commercial availability and universal reference ranges for PNF-H. The study also recognized the small sample size and the limited set of evaluated parameters, and recommended future studies to include multidimensional outcome measures such as pain scores. In conclusion, this study indicates that local application of methylprednisolone acetate may speed up ambulation in dogs after surgery for IVDD through mitigating the inflammatory response and promoting faster recovery. The researchers recommend more studies to validate the findings. This comprehensive study provides valuable insights into the management of IVDD in dogs, demonstrating the potential benefits of local steroid application in improving recovery times. The research highlights the importance of careful monitoring and further exploration of the role of steroids in spinal cord injuries. From Vet NeuroJar, keep those minds inspired, hearts light, and tails wagging.